Imagine this. You're lying on a wooden table. 4 men are holding you down. A surgeon is about to amputate your leg, and you are completely conscious. You will feel every cut, every saw stroke through bone. There's nothing anyone can do to stop your pain. For 10,000 years of human history, this was medicine. Before 1846, surgery was torture. People died from the shock of pain, not the surgery itself. Doctors operated as fast as possible while patients screamed, and religious leaders argued that pain was God's will, that removing it was against nature. This is the story of how we ended the worst suffering for most of human existence. There was no escape from surgical pain. If you needed an operation, you experienced every second of it. Ancient civilizations tried everything. The Egyptians used opium and alcohol. The Chinese experimented with acupuncture and herbal mixtures. The Greeks gave patients mandrake root, which made you drowsy but didn't eliminate pain. The Romans tried a plant called henbane. You might get slightly drunk or feel hazy, but when the knife cut into your flesh, you felt it. The best-case scenario, you passed out from the pain. Doctors sometimes hoped for this. Unconsciousness from shock was the closest thing to anesthesia available. Medieval surgeons developed a mixture called dwale, a combination of bile, opium, hemlock, and wine. And even when it didn't kill you, it barely dulled the pain. Surgeons adapted, becoming fast. In the era before anesthesia, the best surgeons were the fastest surgeons. Robert Liston, a Scottish surgeon in the 1800s, could amputate a leg in under 3 minutes, and his assistants timed him. Spectators watched from galleries. Surgery was a public event, like theater, except the screaming was real. Liston held the knife between his teeth as he worked. He would cut through skin, muscle, and tissue in seconds. Then he'd grab a saw and cut through bone. The faster he worked, the less time the patient spent in agony. Speed saved lives, not from better technique, but from reducing shock. Patients were held down by multiple strong men. Sometimes they were strapped to the table with leather restraints on wrists and ankles. A wooden bit was placed between their teeth to prevent them from biting through their own tongue. Even with restraints, patients thrashed. They fought and begged, and surgeons operated through it. There's a famous story about Robert Liston, so famous it might be exaggerated, but it captures the horror. During one amputation, Liston was moving so fast, he accidentally cut off 2 of his assistants. The patient died later from infection. The assistant died from infection, and a spectator watching from the gallery died from shock. He fainted, hit his head, and never woke up. The only surgery in history with a 300% mortality. But here's the thing most people don't realize. Even the fastest surgeon couldn't operate on certain parts of the body. Without anesthesia, surgery was limited to the surface. Amputations were possible if brutal. Removing surface tumors was doable. Setting broken bones was agonizing but manageable. But anything internal, forget it. You couldn't operate on the abdomen. If a patient had appendicitis, they died. Intestinal blockage, dead. Internal bleeding, dead. You couldn't operate on the chest. Heart problems, hopeless. Lung disease, nothing could be done. You couldn't do delicate work. Eye surgery was nearly impossible when the patient was thrashing in pain. Brain surgery, the human body was mostly inaccessible. Surgeons could only work on what they could reach quickly, cut quickly, and finish before the patient died from shock. Many did die from shock, not infection, not blood loss, but pure pain. Their bodies couldn't handle it. Heart stopped, breathing failed. The doctors knew this and wrote about it, but they had no solution. Then, in the early 1800s, a few people began experimenting with gases. In the 1790s, British chemist Humphrey Davy discovered nitrous oxide laughing gas. He noticed it had an unusual effect. It made people giddy, euphoric, and less sensitive. Davy even suggested it might be useful for surgery, but nobody listened. Instead, nitrous oxide became a party drug. In the 1800s, wealthy people held laughing gas parties. You would inhale the gas, feel lightheaded, laugh uncontrollably, and stumble around. Around the same time, ether, a volatile liquid that produced similar effects, became popular at ether frolics. College students and young men inhaled ether vapors, got intoxicated, and acted foolishly. They were novelties, amusements, until a dentist named William Morton. In 1846, Morton had been experimenting with ether. He'd used it on himself and tested it on his dog. He believed it could work on humans during surgery. On October 16, 1846, he convinced a surgeon named John Collins Warren to let him demonstrate ether on a public surgery at Massachusetts General Hospital. The patient was Edward Gilbert Abbott, a man with a tumor on his neck. Normally, this surgery would be excruciating, cutting into the neck near nerves, blood vessels, airways. Morton administered the ether. Abbott inhaled the vapors. He went unconscious. Abbott didn't move, scream, or react. Warren continued. He removed the tumor, sutured the wound, and when it was over, Abbott woke up. He had no memory of pain. Warren, stunned, turned to the audience and said, "Gentlemen, this is no humbug." That moment changed medicine. But here's the truth. Morton wasn't the first. A dentist named Horace Wells had tried nitrous oxide a year earlier in 1845. He demonstrated it at Harvard Medical School, but the patient woke up mid-surgery and screamed. The demonstration was declared a failure. Wells was humiliated, believing but he hadn't. His idea was right, the dose was wrong. Then there was Crawford Long, a doctor in Georgia. In 1842, 4 years before Morton, Long had used ether during surgery to remove a neck tumor. It worked, but he didn't publish his findings until 1849, after Morton's demonstration became famous. And in England, a doctor named James Simpson discovered chloroform in 1847, a year after Morton. Chloroform was stronger than ether, faster acting, and easier to administer. Simpson used it during childbirth, which scandalized society. So who invented anesthesia? The answer is several people, almost simultaneously. But there was resistance. When anesthesia was introduced, not everyone celebrated. Religious leaders opposed it. Their argument, pain was part of God's design. Suffering was spiritually purifying. To eliminate pain was to interfere with divine will. This was especially true in the Bible. Genesis 3:16, God tells Eve, "In pain you shall bring forth children." For centuries, this was interpreted literally. Women were supposed to suffer during childbirth. It was punishment for original sin. When Simpson started using chloroform to ease labor pain, clergymen were out. They called it blasphemy, unnatural, against scripture. Simpson, a devout Christian himself, fought back. He pointed to Genesis 2:21, when God put Adam into a deep sleep before removing his rib to create Eve. That, he argued, was the first anesthesia divinely sanctioned. His argument, slowly resistance faded. But here's the darker truth. Even as anesthesia became accepted for men, women were still expected to endure childbirth pain. The double standard persisted for decades. It wasn't until Queen Victoria used chloroform during the birth of her 8th child in 1853 that public opinion true. If the Queen could use anesthesia, it must be acceptable. One royal birth changed the rules for millions of women. Once anesthesia existed, surgery transformed overnight. Operations that were impossible became routine. Surgeons could take their time, be precise, and work on internal organs without patients. Abdominal surgeries became possible. Appendicitis went from a death sentence to a survivable operation. Chest surgeries became feasible. Lung disease could be treated, and heart problems could eventually be addressed. Delicate operations became realistic. Eye surgery improved, and brain surgery, once unthinkable. But there was a problem. Anesthesia solved pain, but didn't solve infection. Surgeons still didn't wash their hands. They operated in street clothes and used the same unwashed instruments on multiple patients. Operating rooms were filthy. Anesthesia meant surgeons could work longer, but longer surgeries. For a while, death rates actually increased after anesthesia was introduced. Not because of the anesthesia itself, but because surgeons could now do more complex operations, creating more opportunities for infection. It wasn't until the 1860s, when Joseph Lister introduced antiseptic techniques, that surgery became truly safe. Anesthesia plus antiseptics, pain elimination plus infection control. Together they created modern surgery. Today, anesthesia is so routine we barely think about it. You go in for surgery, an anesthesiologist administers drugs, you count backward from 10, and you wake up hours later, operation complete, with no memory. Modern anesthesia is extraordinarily sophisticated. Anesthesiologists monitor vital signs, adjust drug dosages in real time, keeping you in a controlled state between consciousness and death, enough to be unaware while staying alive. We trust it completely, lying down on operating tables, allowing ourselves to be rendered unconscious. For 99.9% of surgeries we do, but here's what unsettles people when they think about it. We still don't fully understand how anesthesia works. We know it stops pain signals and suppresses consciousness, but the exact mechanism remains partially mysterious. We're using a technology we don't completely understand. For 10,000 years, surgery meant torture. Every broken bone set, every tooth pulled, every tumor removed, fully conscious, fully aware, fully in agony. Anesthesia didn't just make surgery more comfortable. It made modern medicine possible. Every medical advancement we take for granted exists because someone figured out, and it happened less than 200 years ago. Your great-great-great-grandparents lived in a world where surgery was conscious torture. We live in the first era of human history where pain can be turned off completely, safely, reliably. From screaming patients held down by force to the quiet operating rooms of today, anesthesia ended. It transformed surgery from torture into medicine, and it did it in a single generation. History is everywhere, even in the darkness before you wake up.